Here are 10 deadly diseases that commonly affect people over the age of 60, along with clear explanations of each. 1. Heart disease, cardiovascular disease. Description: includes conditions like heart attacks, coronary artery disease, and congestive heart failure. Why it's deadly: blood flow to the heart can be blocked or reduced, leading to heart failure or sudden death. Common symptoms: chest pain, shortness of breath, fatigue, and irregular heartbeat. 2. Stroke. Description: occurs when the blood supply to part of the brain is interrupted or reduced. Why it's deadly: brain cells die quickly without oxygen, potentially causing permanent disability or death. Common symptoms: sudden weakness, facial drooping, slurred speech, and vision problems. 3. Chronic obstructive pulmonary disease, COPD. Description: a group of lung diseases, including emphysema and chronic bronchitis, that block airflow. Why it's deadly: progressive and irreversible, making breathing increasingly difficult. Common symptoms: chronic cough, shortness of breath, wheezing, and fatigue. 4. Alzheimer's disease. Description: a progressive brain disorder that destroys memory, thinking skills, and eventually physical function. Why it's deadly: it causes brain failure and makes it difficult to eat, move, and function. Common symptoms: memory loss, confusion, mood swings, and difficulty speaking or walking. 5. Cancer, various types. Description: uncontrolled growth of abnormal cells that invade and damage tissues and organs. Why it's deadly: spreads throughout the body, metastasis, disrupting critical organ function. Common types in older adults: lung, colon, prostate, breast, and pancreatic cancers. 6. Pneumonia. Description: a serious lung infection often caused by bacteria or viruses. Why it's deadly: older adults have weaker immune systems, making recovery harder. Common symptoms: cough, fever, chills, difficulty breathing, and chest pain. 7. Diabetes complications. Description: high blood sugar over time damages organs, blood vessels, and nerves. Why it's deadly: leads to heart disease, kidney failure, infections, and amputations. Common symptoms: fatigue, blurry vision, slow healing wounds, and frequent urination. 8. Kidney disease, chronic kidney disease, CKD. Description: gradual loss of kidney function over time. Why it's deadly: leads to waste buildup in the body, requiring dialysis or transplant. Common symptoms: swelling, fatigue, nausea, and changes in urination. 9. Sepsis. Description: a life-threatening reaction to infection causing systemic inflammation. Why it's deadly: can lead to organ failure and death very quickly if not treated immediately. Common symptoms: fever, confusion, rapid heartbeat, and cold, clammy skin. 10. Parkinson's disease. Description: a progressive disorder affecting movement and coordination. Why it's deadly: leads to complications like falls, pneumonia, and loss of independence. Common symptoms: tremors, stiffness. 1. Heart disease, cardiovascular disease. Description: includes conditions like heart attacks, coronary artery disease, and congestive heart failure. Why it's deadly: blood flow to the heart can be blocked or reduced, leading to heart failure or sudden death. Common symptoms: chest pain, shortness of breath, fatigue, and irregular heartbeat. 2. Stroke. Description: occurs when the blood supply to part of the brain is interrupted or reduced. Why it's deadly: brain cells die quickly without oxygen, potentially causing permanent disability or death. Common symptoms: sudden weakness, facial drooping, slurred speech, and vision problems. 3. Chronic obstructive pulmonary disease, COPD. Description: a group of lung diseases, including emphysema and chronic bronchitis, that block airflow. Why it's deadly: progressive and irreversible, making breathing increasingly difficult. Common symptoms: chronic cough, shortness of breath, wheezing, and fatigue. 4. Alzheimer's disease. Description: a progressive brain disorder that destroys memory, thinking skills, and eventually physical function. Why it's deadly: it causes brain failure and makes it difficult to eat, move, and function. Common symptoms: memory loss, confusion, mood swings, and difficulty speaking or walking. 5. Cancer, various types. Description: uncontrolled growth of abnormal cells that invade and damage tissues and organs. Why it's deadly: spreads throughout the body, metastasis, disrupting critical organ function. Common types in older adults: lung, colon, prostate, breast, and pancreatic cancers. 6. Pneumonia. Description: a serious lung infection often caused by bacteria or viruses. Why it's deadly: older adults have weaker immune systems, making recovery harder. Common symptoms: cough, fever, chills, difficulty breathing, and chest pain. 7. Diabetes complications. Description: high blood sugar over time damages organs, blood vessels, and nerves. Why it's deadly: leads to heart disease, kidney failure, infections, and amputations. Common symptoms: fatigue, blurry vision, slow healing wounds, and frequent urination. 8. Kidney disease, chronic kidney disease, CKD. Description: gradual loss of kidney function over time. Why it's deadly: leads to waste buildup in the body, requiring dialysis or transplant. Common symptoms: swelling, fatigue, nausea, and changes in urination. 9. Sepsis. Description: a life-threatening reaction to infection causing systemic inflammation. Why it's deadly: can lead to organ failure and death very quickly if not treated immediately. Common symptoms: fever, confusion, rapid heartbeat, and cold, clammy skin. 10. Parkinson's disease. Description: a progressive disorder affecting movement and coordination. Why it's deadly: leads to complications like falls, pneumonia, and loss of independence. Common symptoms: tremors, stiffness. Heart disease, cardiovascular disease. Heart disease, also known as cardiovascular disease, CVD, is the leading cause of death worldwide, especially for people over the age of 60. This group of conditions affects the heart and blood vessels and includes heart attacks, coronary artery disease, heart failure, and arrhythmias. As people age, their risk of developing heart disease increases significantly due to factors like high blood pressure, cholesterol buildup, lifestyle habits, and the natural wear and tear on the cardiovascular system. One of the most common forms of heart disease is coronary artery disease, CAD. This condition occurs when the arteries that supply blood to the heart muscle become narrowed or blocked by plaque, a mix of fat, cholesterol, and other substances. Over time, this buildup restricts blood flow, which can lead to a heart attack when the blood supply is suddenly and completely blocked. Another serious consequence is congestive heart failure, CHF, a chronic condition where the heart becomes too weak to pump blood efficiently, leading to fluid buildup in the lungs and other parts of the body. Heart disease is often called a silent killer because it can develop gradually with few or no symptoms until a serious event occurs. However, there are several warning signs that individuals should watch for. Chest pain or discomfort, often described as pressure, squeezing, or fullness, is a classic symptom of a heart attack. Shortness of breath, particularly during physical activity or while lying flat, may signal heart failure. Fatigue, dizziness, and irregular heartbeat, arrhythmia, are also common, though they may be mistaken for less serious issues, especially in older adults. The danger of heart disease lies in its ability to cause sudden and severe complications. A heart attack can result in irreversible damage to the heart muscle or even sudden death. Heart failure, while often manageable in its early stages, can progress and lead to multiple organ dysfunction. Additionally, heart disease increases the risk of stroke, kidney damage, and other serious health conditions. Prevention and early detection are key to reducing the risk of heart disease. Regular checkups, blood pressure monitoring, cholesterol control, and lifestyle changes, such as quitting smoking, eating a heart-healthy diet, exercising regularly, and managing stress, play critical roles in heart health. Medications may also be prescribed to control blood pressure, cholesterol, and heart rhythm issues. For those over 60, understanding the symptoms and risks of heart disease can literally be life-saving. It's important not to ignore warning signs or dismiss them as just part of getting older. With proper medical care, lifestyle management, and awareness, many people can live full and active lives, even with a diagnosis of heart disease. 2. Stroke description. A stroke is a serious and potentially life-threatening medical condition that occurs when the blood supply to a part of the brain is either interrupted or significantly reduced, preventing brain tissue from receiving the oxygen and nutrients it needs to function. Within minutes of losing its oxygen supply, brain cells begin to die, which can lead to permanent brain damage, severe disability, or even death if not treated immediately. There are two main types of stroke. Ischemic stroke, most common, accounting for about 85% of all strokes, caused by a blocked artery, usually due to a blood clot or fatty deposits, plaque, that restrict blood flow to the brain. Hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing bleeding into or around the brain. This can result from high blood pressure, aneurysms, or trauma. A transient ischemic attack, TIA, often called a mini-stroke, is a temporary blockage of blood flow to the brain that typically resolves within minutes or hours. While a TIA doesn't cause permanent damage, it's a serious warning sign of a future full-blown stroke. Why it's deadly. Strokes are especially dangerous because they occur suddenly and can cause irreversible damage in a very short time. Unlike other parts of the body, brain tissue does not regenerate easily. So when parts of the brain die due to lack of oxygen, the abilities controlled by that part, such as speech, movement, memory, or vision, may be permanently lost. In severe cases, a stroke can result in instant death if major parts of the brain are affected, cause long-term disability, such as paralysis, loss of speech, or cognitive impairment, lead to loss of independence, especially in elderly individuals, increase the risk of recurrent strokes, each one compounding the damage. In people over 60, the risk is particularly high due to factors like high blood pressure, atherosclerosis, hardened arteries, heart disease, diabetes, and lifestyle factors. Women and people with a family history of stroke also face a higher risk. Common symptoms. Recognizing the signs of a stroke early is critical. Every minute counts, as faster treatment means a better chance at recovery and survival. The most common and telltale symptoms can be remembered with the acronym FAST. F. Face drooping. One side of the face may droop or become numb. Ask the person to smile and check if the smile is uneven. A. Arm weakness. One arm may become weak or numb. Ask the person to raise both arms. If one drifts downward, it could be a stroke. S. Speech difficulty. The person may have slurred or strange speech. Ask them to repeat a simple sentence. T. Time to call emergency services. If any of these signs are present, call for medical help immediately. Other symptoms include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Confusion, trouble speaking or understanding speech, vision problems in one or both eyes, difficulty walking, dizziness or loss of coordination, a sudden severe headache with no known cause. Even if the symptoms disappear quickly, as in a TIA, they should be taken seriously and medical help should be sought right away. Treatment and recovery. Treatment for stroke depends on the type and severity. For ischemic strokes, doctors may use a clot-busting drug like TPA, tissue plasminogen activator, which must be administered within a few hours of symptom onset to be effective. Mechanical thrombectomy may be used to physically remove a blood clot from a large artery. For hemorrhagic strokes, the focus is on stopping the bleeding, controlling intracranial pressure, and sometimes performing surgery. Rehabilitation is often necessary after a stroke and may include physical therapy to regain movement and balance, speech therapy to help with communication difficulties, occupational therapy to relearn daily activities, psychological support to cope with emotional effects like depression and anxiety. Recovery depends on how quickly the person received treatment and how much brain damage occurred. Some people recover completely, while others may have lasting impairments. Prevention. The best way to reduce the risk of stroke is through prevention and early detection of risk factors. Control high blood pressure, the leading cause of stroke. Manage cholesterol and diabetes. Quit smoking and limit alcohol intake. Exercise regularly and maintain a healthy weight. Eat a balanced diet, low in saturated fats and high in fruits, vegetables, and whole grains. Take prescribed medications consistently, especially for heart conditions or blood thinning. Monitor heart rhythm, particularly for atrial fibrillation, AFib, a condition that increases stroke risk. For older adults, regular checkups and health screenings can be life-saving. It's also important for caregivers and family members to know the signs of stroke and act quickly when they appear. Conclusion: a stroke can strike suddenly but leave a lifetime of consequences. It is among the most dangerous conditions for adults over 60, not only because of its fatal potential, but also due to the severe disability it can cause. Recognizing the symptoms early, seeking immediate medical help, and maintaining a healthy lifestyle are critical steps in prevention and survival. Stroke doesn't just affect individuals, it affects families, independence, and quality of life. But with awareness, quick action, and the right support, many stroke survivors go on to lead meaningful lives. 3. Chronic obstructive pulmonary disease, COPD. Description: chronic obstructive pulmonary disease, COPD, is a progressive and potentially life-threatening condition that refers to a group of lung diseases, primarily emphysema and chronic bronchitis, that cause airflow blockage and breathing-related problems. COPD is one of the leading causes of death worldwide, particularly among older adults, and it significantly affects quality of life and independence in later years. In chronic bronchitis, the lining of the airways, bronchi, becomes constantly inflamed and produces excess mucus, leading to persistent coughing and difficulty breathing. In emphysema, the air sacs in the lungs, alveoli, are damaged and lose their elasticity, making it harder for oxygen to pass into the bloodstream. Most people with COPD have both conditions to varying degrees. The primary cause of COPD is long-term exposure to lung irritants, especially cigarette smoke. However, exposure to air pollution, dust, chemical fumes, and biomass fuel smoke, common in indoor cooking in some countries, can also contribute. In rare cases, a genetic disorder called alpha-1 antitrypsin deficiency can cause COPD even in non-smokers. Why it's deadly? COPD is particularly dangerous because it is chronic, progressive, and irreversible. Over time, the damage to the lungs worsens, reducing the amount of oxygen that can be absorbed into the bloodstream and making it increasingly difficult to breathe. While symptoms may start off mild, the condition typically progresses, especially without treatment or lifestyle changes. The progressive nature of COPD means that breathing becomes more difficult over time, even during rest. People with severe COPD may become dependent on oxygen therapy or experience frequent and life-threatening exacerbations, sudden flare-ups of symptoms, often triggered by infections or environmental pollutants. Without adequate oxygen, vital organs, including the heart and brain, are affected. This can lead to complications such as heart problems, including right-sided heart failure, cor pulmonale, respiratory infections like pneumonia, depression and anxiety due to reduced physical ability and isolation, weight loss and muscle wasting as the body struggles to function efficiently. In advanced stages, COPD can become fatal, especially when compounded by other chronic illnesses common in older age, such as heart disease or diabetes. Although it cannot be cured, early diagnosis and proper management can help slow its progression and improve the quality of life. Common symptoms. The symptoms of COPD often develop slowly, and many people may ignore or misattribute them to aging or lack of fitness. However, being aware of the early warning signs can lead to earlier treatment and better outcomes. Key symptoms include chronic cough, a persistent cough that may produce mucus, phlegm, often worse in the morning, shortness of breath, dyspnea, especially during physical activity. In later stages, even simple tasks like walking or getting dressed can be exhausting. Wheezing, a high-pitched whistling sound when breathing due to narrowed airways. Chest tightness, a sensation of pressure or heaviness in the chest. Fatigue as the lungs work harder to supply oxygen. The body becomes more easily tired. Frequent respiratory infections. People with COPD are more vulnerable to colds, flu, and pneumonia. As the disease progresses, flare-ups or exacerbations may become more frequent and severe, often requiring hospitalization. These episodes are dangerous and can accelerate the decline of lung function. Diagnosis and treatment. Diagnosing COPD usually involves Spirometry, a breathing test that measures how much air a person can exhale and how fast. Chest X-rays or CT scans to detect emphysema or rule out other conditions. Blood tests to check oxygen and carbon dioxide levels. There is no cure for COPD, but treatment can slow its progression and help manage symptoms. Common treatment strategies include lifestyle changes. Quitting smoking is the most critical step. Avoiding air pollutants and respiratory irritants. Engaging in regular, moderate exercise to strengthen the lungs and muscles. Medications. Bronchodilators to relax the airway muscles and improve airflow. Inhaled steroids to reduce inflammation. Antibiotics to treat respiratory infections. Oxygen therapy for people with severe COPD and low oxygen levels in the blood. Pulmonary rehabilitation, a specialized program of exercise, education, and support designed to improve breathing and emotional well-being. In advanced cases, some patients may be considered for lung volume reduction surgery or lung transplant, though these are rare and typically reserved for younger patients with specific criteria. Living with COPD. COPD not only affects physical health, but can also lead to emotional and social challenges. Many individuals with COPD experience anxiety, depression, and isolation due to limited mobility and the fear of breathlessness. Support groups, counseling, and a strong care network are essential. It's also vital to plan for emergencies, keeping rescue inhalers on hand, getting annual flu and pneumonia vaccines, and creating an action plan for flare-ups. Older adults should maintain regular follow-ups with a healthcare provider to adjust treatment as needed and monitor the disease's progression. Conclusion. Chronic obstructive pulmonary disease is a slow but serious condition that affects millions, particularly those over 60. Its effects on the lungs are irreversible, but with early diagnosis, lifestyle adjustments, and medical care, people with COPD can still lead active, meaningful lives. The key is awareness. Understanding the symptoms, recognizing the risks, and acting early can make all the difference. 4. Alzheimer's disease description. Alzheimer's disease is a progressive neurodegenerative disorder that gradually destroys memory, cognitive abilities, and eventually the capacity to perform basic physical functions. It is the most common cause of dementia, accounting for 60 to 80% of dementia cases worldwide, and primarily affects people over the age of 65. As life expectancy continues to rise globally, Alzheimer's disease has become one of the most serious and devastating health challenges among the elderly. Alzheimer's develops when abnormal protein deposits in the brain, mainly beta amyloid plaques and tau tangles, disrupt communication between brain cells and eventually lead to their death. This damage first appears in the hippocampus, the part of the brain involved in memory, and then spreads to other areas responsible for reasoning, behavior, and eventually movement and vital bodily functions. While Alzheimer's disease progresses differently in each individual, it generally follows a slow and relentless decline. In the early stages, a person may only experience mild forgetfulness. However, as the disease advances, it leads to severe memory loss, confusion, disorientation, personality changes, and physical decline. Why it's deadly. Alzheimer's is not just a memory problem. It is a terminal illness. Over time, as more brain cells die, the brain shrinks and loses the ability to manage even the most basic bodily functions, such as swallowing, walking, and controlling the bladder or bowels. In the final stages of Alzheimer's, individuals become completely dependent on others for care. They may be bedridden, unable to speak, and vulnerable to infections like pneumonia, which is often the immediate cause of death in many Alzheimer's cases. The inability to eat or drink properly can also lead to malnutrition and dehydration, further accelerating physical decline. There is currently no cure for Alzheimer's, and the available treatments only help manage symptoms temporarily. As the disease progresses, it affects not only the person with Alzheimer's, but also their families, caregivers, and loved ones. It becomes emotionally, physically, and financially exhausting. Common symptoms. Recognizing the symptoms of Alzheimer's early can lead to a timely diagnosis and better planning for care. While memory loss is the most well-known symptom, Alzheimer's affects many different aspects of mental and physical functioning. Cognitive symptoms: memory loss, forgetting recently learned information, important dates, or asking the same questions repeatedly. Confusion with time or place, not knowing the date, season, or where they are. Difficulty solving problems or planning, struggling with tasks like managing finances or following a recipe. Trouble understanding visual images, difficulty reading, judging distance, or recognizing familiar faces. Behavioral and emotional symptoms: mood swings, sudden changes in mood, including anxiety, depression, anger, or fear. Withdrawal from social activities, loss of interest in hobbies or spending time with others. Personality changes, becoming suspicious, confused, or apathetic. Physical and functional symptoms in later stages: difficulty speaking or writing, trouble finding the right words or maintaining conversations. Problems with walking or coordination, leading to frequent falls. Difficulty swallowing, dysphagia, leading to choking hazards or aspiration pneumonia. Incontinence and loss of bowel or bladder control. The progression of Alzheimer's is often divided into 3 stages: early, mild, subtle memory loss, trouble with planning or organization; middle, moderate, noticeable confusion, mood changes, and dependence on caregivers; late, severe inability to communicate, recognize loved ones, and control physical functions. Risk factors and causes. While the exact cause of Alzheimer's remains unclear, several risk factors have been identified. Age. Risk increases dramatically after age 65. Genetics. A family history of Alzheimer's or carrying certain genes, like APOE4. Lifestyle factors: poor diet, lack of exercise, smoking, and unmanaged conditions like high blood pressure, diabetes, or obesity. Head trauma. A history of serious head injuries may increase risk. Gender. Women are more likely than men to develop Alzheimer's, possibly due to longer life expectancy. Diagnosis and treatment. There is no single test to diagnose Alzheimer's. Doctors use a combination of medical history, neurological exams, cognitive testing, and brain imaging, like MRI or PET scans, to make a diagnosis and rule out other conditions. While no cure exists, some medications can temporarily improve symptoms or slow progression. Cholinesterase inhibitors, like donepezil, rivastigmine, improve communication between nerve cells. Memantine regulates activity of glutamate, a neurotransmitter involved in memory and learning. In 2021, the FDA approved aducanumab, Aduhelm, and later lecanemab, Leqembi, drugs that target beta-amyloid plaques, though their effectiveness and use remain controversial. Supportive care such as structured routines, memory aids, physical activity, and caregiver support plays a critical role in managing Alzheimer's and maintaining quality of life for as long as possible. Living with Alzheimer's. Alzheimer's is not just a medical issue, it's a social and emotional journey. As the disease advances, individuals lose their ability to participate in relationships, conversations, and decision-making. Families often experience grief well before death occurs, a phenomenon known as anticipatory grief. Caring for someone with Alzheimer's requires patience, flexibility, and resources. Support groups, respite care, adult day programs, and home modifications can all help improve quality of life. Legal and financial planning early in the disease is essential for decisions about guardianship, long-term care, and end-of-life preferences. Conclusion: Alzheimer's disease is one of the most devastating conditions associated with aging. Its effects go far beyond memory loss. It eventually takes away a person's independence, identity, and ability to survive. With no known cure and a growing number of older adults at risk, Alzheimer's represents not only a personal crisis, but also a public health challenge. Awareness, early diagnosis, compassionate care, and research into new treatments are essential to fight back against this deadly disease. While the journey is difficult, education and support can make it more manageable for patients and families alike. 5. Cancer, various types. Description: cancer is a group of more than 100 diseases characterized by the uncontrolled growth of abnormal cells. These cells divide and multiply rapidly, forming tumors that can invade and damage healthy tissues and organs. Unlike normal cells that grow, divide, and die in a regulated manner, cancer cells evade these natural controls and continue multiplying, often without any functional purpose. In some cases, cancer remains localized in one area, but it can also spread to other parts of the body through the bloodstream or lymphatic system, a process known as metastasis. Once cancer metastasizes, it becomes much harder to treat and can quickly become life-threatening. Cancer is not a single disease, but rather a complex category of diseases that behave differently depending on the type, location, and stage. Some cancers grow slowly and are relatively easy to manage, while others are aggressive and rapidly fatal. Regardless of the type, early detection and treatment are crucial for improving survival rates. Why it's deadly. Cancer becomes deadly when it begins to interfere with the normal function of vital organs, such as the lungs, liver, brain, or bone marrow. As it spreads, cancer disrupts essential processes like breathing, digestion, immune function, and blood cell production. Even cancers that begin in seemingly less critical organs can cause fatal complications once they metastasize. In addition to direct organ damage, cancer and its treatments can cause systemic issues. Cachexia, extreme weight and muscle loss. Suppressed immune system, increasing vulnerability to infections. Blood clots and bleeding disorders. Organ failure, as tumors physically block or destroy tissues. Cancer is also insidious because its early symptoms are often subtle or mistaken for other less serious conditions, especially in older adults. By the time it's diagnosed, it may already be at an advanced or metastatic stage. Why older adults are at greater risk. Age is the single greatest risk factor for cancer. Nearly 60% of cancer diagnoses and 70% of cancer deaths occur in people aged 65 and older. This increased risk is due to a combination of genetic, environmental, and physiological factors. Accumulated DNA damage over time, weakened immune system, which makes it harder to detect and destroy abnormal cells, prolonged exposure to carcinogens, tobacco, pollution, chemicals, chronic inflammation and underlying conditions like diabetes or heart disease, delayed screenings or vague symptoms being dismissed as just aging. Because of these factors, it's crucial for older adults to stay informed about early warning signs and to undergo regular screenings. Common types of cancer in older adults. Here are the most prevalent and dangerous cancers found in people over 60. 1. Lung cancer. Description. Often caused by long-term smoking, but also occurs in non-smokers. Symptoms: persistent cough, coughing up blood, chest pain, weight loss, shortness of breath. Why it's deadly. Often diagnosed late, after it has spread. Very aggressive. 2. Colorectal cancer, colon and rectal. Description. Affects the large intestine and rectum. Symptoms: blood and stool, constipation or diarrhea, unexplained weight loss, fatigue. Why it's deadly. Frequently develops without symptoms. Early detection through colonoscopy is critical. 3. Prostate cancer. Description. Common in men over 60, often slow-growing. Symptoms: difficulty urinating, weak urine flow, pelvic discomfort, bone pain in advanced stages. Why it's deadly. Can spread to bones and lymph nodes. Aggressive forms can be fatal without treatment. 4. Breast cancer. Description. While often associated with younger women, it is also common in older women. Symptoms: lump in the breast, nipple discharge, skin dimpling or swelling. Why it's deadly. If not caught early, it can spread to lungs, liver, brain, or bones. 5. Pancreatic cancer. Description. Often called a silent killer because symptoms appear late. Symptoms: jaundice, weight loss, abdominal pain, loss of appetite. Why it's deadly. Fast-growing, often diagnosed at an advanced stage. Survival rates are very low. Diagnosis and treatment. Diagnosing cancer typically involves a combination of blood tests, imaging scans, X-ray, CT, MRI, PET, biopsies, removal of tissue for lab analysis, tumor markers in the blood. Treatment depends on the type, location, and stage of cancer, as well as the patient's overall health and age. Options may include surgery to remove tumors. Chemotherapy uses drugs to kill cancer cells or stop their growth. Radiation therapy targets and destroys cancerous tissue with high-energy rays. Immunotherapy helps the immune system recognize and fight cancer. Targeted therapy uses drugs that specifically target cancer cells' abnormalities. For older adults, treatment decisions can be complex, balancing effectiveness with potential side effects and quality of life. Geriatric oncology specialists often work with patients to create personalized treatment plans. Living with cancer in older age. Cancer not only affects the body, but also deeply impacts emotional and mental health. Older patients may face fear of losing independence, isolation or depression, financial stress due to treatment costs. Palliative care, even during treatment, can improve comfort, reduce symptoms, and support mental health. In cases where a cure is not possible, hospice care provides dignity and support in end-of-life stages. Caregivers and families also play a crucial role, offering emotional, physical, and logistical support. Many organizations offer resources, counseling, and support groups to help navigate the journey. Conclusion. Cancer is a complex and deadly disease, especially for individuals over 60. Its impact can be profound, but early detection, informed decisions, and strong support systems can significantly affect outcomes. With ongoing research, improved treatments, and greater awareness, there is hope not only for longer life, but for a better quality of life, even in the face of cancer. 6. Pneumonia. Description: pneumonia is a serious and potentially life-threatening infection that causes inflammation in the air sacs, alveoli, of one or both lungs. These air sacs may fill with fluid or pus, leading to a host of respiratory symptoms and impaired oxygen exchange. Pneumonia can be caused by bacteria, viruses, fungi, or even inhaled irritants, but bacterial and viral infections are the most common sources. In healthy adults, pneumonia can often be treated effectively. However, in older adults, over age 60, pneumonia becomes far more dangerous due to weakened immune function, pre-existing health conditions, and age-related decline in lung capacity. It's no surprise that pneumonia is often referred to as the old man's friend, a euphemism rooted in its historical association with high mortality among the elderly. Pneumonia is also a leading cause of hospital admissions and death among older populations. Even with modern medical care, complications from pneumonia can be severe and lingering. Why it's deadly. Pneumonia is deadly for older adults for several key reasons. Weakened immune system. As people age, their immune response slows down. This makes it harder for the body to fight off infections efficiently, allowing pneumonia to progress quickly and aggressively. Pre-existing conditions. Many older adults have chronic illnesses such as heart disease, diabetes, COPD, or cancer. These comorbidities weaken the body further, complicating treatment and slowing recovery. Decreased lung function. With age, the elasticity of lung tissue decreases, and the ability to clear mucus and pathogens weakens. This makes older individuals more susceptible to lung infections and respiratory failure. Increased risk of complications. Pneumonia can lead to severe complications such as sepsis, a life-threatening reaction to infection, respiratory failure, lung abscesses, pleural effusion, fluid around the lungs, worsening of chronic conditions, delayed diagnosis. Symptoms of pneumonia in older adults are sometimes vague or mistaken for other conditions, leading to delayed treatment, which can increase the risk of severe illness or death. Common symptoms. Recognizing the signs of pneumonia early is essential for timely treatment. The classic symptoms include cough, often producing green, yellow, or bloody mucus. Fever and chills, may be absent in frail or elderly individuals. Shortness of breath, especially during normal activities or while resting. Chest pain, sharp or stabbing, especially when coughing or inhaling. Fatigue and weakness. Confusion or delirium, particularly in older adults. Confusion may be the first or only symptom. Sweating or clammy skin. Loss of appetite. In elderly individuals, pneumonia can present atypically, without fever or cough, and instead manifest as sudden confusion, extreme tiredness, or a fall. This makes it essential for caregivers and family members to watch closely for subtle changes. Types of pneumonia. Pneumonia is classified based on how it is acquired. Community-acquired pneumonia, CAP, The most common form, acquired outside of hospitals or healthcare settings. It is usually caused by bacteria like Streptococcus pneumoniae or viruses like influenza. Hospital-acquired pneumonia, HAP, acquired during hospital stays, often more severe due to antibiotic-resistant bacteria. Aspiration pneumonia, caused by inhaling food, drink, vomit, or saliva into the lungs, common in people with swallowing difficulties or neurological conditions like stroke or dementia. Ventilator-associated pneumonia, VAP, occurs in people using breathing machines, ventilators, in intensive care units. Diagnosis and treatment. Diagnosing pneumonia typically involves physical exam and listening to the lungs, chest X-ray to identify fluid or consolidation, blood tests to check for infection, sputum tests to identify the causative organism.
Pulse oximetry or arterial blood gases to measure oxygen levels.
Treatment depends on the cause. Bacterial pneumonia, treated with antibiotics, oral or intravenous. Viral pneumonia, treated with supportive care and, in some cases, antiviral medications. Hospitalization may be required for severe cases, particularly in elderly or frail patients. Supportive treatments may include oxygen therapy, fluids and electrolytes, fever and pain reducers, rest and respiratory therapy. Recovery can be slow for older adults, often taking weeks or months, and may require rehabilitation or home care support.
Prevention.
Prevention is a key strategy, especially for older adults. The following measures can significantly reduce the risk of pneumonia. Vaccinations. Pneumococcal vaccine, recommended for all adults 65 and older. Influenza vaccine. Annual flu shots help prevent flu-related pneumonia. COVID-19 vaccine, reduces risk of severe viral pneumonia. Quit smoking. Smoking damages lung tissue and impairs the lung's ability to fight infection. Manage chronic conditions. Keeping illnesses like diabetes, COPD, and heart disease under control lowers overall risk. Good hygiene. Frequent hand washing and avoiding close contact with sick individuals help prevent infections. Oral care and swallowing assessment, especially in nursing homes or for individuals with dementia or stroke history. Maintaining good oral hygiene and assessing swallowing ability helps prevent aspiration pneumonia. Conclusion. Pneumonia is far more than a simple chest infection, especially for older adults. It poses serious risks due to declining immune defenses, existing health conditions, and slower recovery times. What may begin as a minor cough or slight confusion can escalate rapidly into a life-threatening emergency if not recognized and treated promptly. With early detection, appropriate medical care, and preventive strategies, the risks of pneumonia can be significantly reduced. For seniors and their caregivers, awareness and action are the most powerful tools in protecting against pneumonia. 7. Diabetes complications description. Diabetes mellitus, commonly known as diabetes, is a chronic metabolic disorder where the body cannot properly regulate blood sugar, glucose levels. There are two main types: type 1 diabetes, typically diagnosed in childhood and requiring insulin therapy, and type 2 diabetes, which is more common and typically develops in adulthood. Type 2 diabetes accounts for over 90% of diabetes cases worldwide and is especially prevalent in older adults. The primary issue in diabetes is high blood sugar, hyperglycemia, which occurs either because the body does not produce enough insulin, a hormone that regulates blood sugar, or cannot effectively use the insulin it produces. Over time, persistent high blood sugar damages blood vessels, organs, and nerves, leading to a wide range of serious and sometimes deadly complications. Managing blood sugar is vital, but for many individuals, especially older adults, diabetes becomes more dangerous because of the cumulative effect of high glucose levels on the body over years or even decades. Why it's deadly. Diabetes is often referred to as a silent killer because its complications develop gradually and can go unnoticed until they become severe. Many of the most life-threatening outcomes of diabetes are indirect, stemming from damage it causes throughout the body. 1. Heart disease and stroke. People with diabetes are up to 4 times more likely to develop heart disease or suffer a stroke than those without it. Elevated blood sugar levels damage the lining of blood vessels, encouraging plaque buildup, atherosclerosis, which leads to high blood pressure, narrowed arteries, and poor circulation. This is the most common cause of death in people with diabetes. 2. Kidney failure, diabetic nephropathy. The kidneys filter waste from the blood, but excess sugar damages the delicate filtering system over time. This can lead to chronic kidney disease, eventually progressing to end-stage renal failure, requiring dialysis or a kidney transplant. Diabetes is the leading cause of kidney failure worldwide. 3. Nerve damage, diabetic neuropathy. High blood sugar damages nerves throughout the body, especially in the legs and feet. This leads to numbness, tingling, pain, and loss of sensation, which may prevent a person from noticing injuries or infections. Over time, this can result in serious infections, ulcers, and even amputations. 4. Vision loss, diabetic retinopathy. Diabetes can damage the tiny blood vessels in the eyes, leading to blurred vision, glaucoma, cataracts, or even blindness. Diabetic retinopathy is a leading cause of vision loss among working-age adults and seniors. 5. Increased infection risk. High glucose levels weaken the immune system and create an environment where bacteria and fungi thrive. People with diabetes are more prone to skin infections, urinary tract infections, gum disease, and slow-healing wounds, all of which can become serious if untreated. 6. Amputations. Foot complications are one of the most devastating outcomes of diabetes. Poor circulation and neuropathy make the feet especially vulnerable. Minor cuts or blisters can turn into deep infections, and when wounds don't heal properly, amputation becomes necessary. Diabetic foot complications are responsible for the majority of non-traumatic amputations worldwide. Common symptoms of diabetes and its complications. Many diabetes-related symptoms seem minor at first, but signal deeper damage occurring in the body. Fatigue, persistent tiredness due to poor glucose regulation and organ strain. Blurry vision, a result of fluid changes in the eye caused by fluctuating blood sugar. Slow healing wounds, especially on the feet and legs, a major warning sign. Frequent urination and thirst, classic signs of high blood sugar. Numbness or tingling in the extremities indicates nerve damage. Unexplained weight loss, often a symptom of uncontrolled type 1 diabetes. Recurring infections, such as yeast infections or UTIs. In older adults, symptoms may be subtle or attributed to aging, making early diagnosis and regular monitoring crucial. Prevention and management. While diabetes itself is manageable, its complications can be debilitating or fatal if left unchecked. Effective management involves a multifaceted approach. 1. Blood sugar control. Keeping blood sugar within target ranges is the most critical part of managing diabetes. This can be achieved through medication or insulin therapy. Dietary changes, e.g., limiting sugar, refined carbs, and processed foods. Regular exercise. Monitoring blood glucose levels at home. 2. Regular screening. Routine checkups can catch complications early. Eye exams for retinopathy, foot exams for ulcers and nerve damage, kidney function tests, cardiovascular risk assessments. 3. Lifestyle modifications. Healthy diet. High in fiber, lean proteins, and whole grains. No smoking. Smoking significantly raises the risk of heart disease and poor circulation. Limit alcohol. Excessive alcohol can interfere with blood sugar control. 4. Vaccinations. Because of weakened immune responses, people with diabetes should stay up to date on vaccines, including flu, pneumonia, hepatitis B, and COVID-19. Living with diabetes in older age. Older adults with diabetes face additional challenges. They may have cognitive decline, reduced mobility, or trouble managing medication. Caregiver involvement, clear routines, and simplified treatment plans can make a big difference. Additionally, the emotional toll of diabetes, dealing with chronic illness, fear of complications, or reduced independence, should not be overlooked. Mental health support and community resources can help improve quality of life. Conclusion. While diabetes itself is not immediately deadly, its complications can quietly and relentlessly damage nearly every part of the body, eventually leading to disability, hospitalization, or death. For people over 60, the risks are even higher due to reduced immune function, slower healing, and multiple comorbidities. But with early detection, consistent treatment, and ongoing lifestyle changes, many people with diabetes can live long, full lives. Awareness, education, and proactive care are key to preventing the silent damage that diabetes causes over time. 8. Kidney disease, chronic kidney disease, CKD. Description: chronic kidney disease, CKD, is a long-term condition characterized by the gradual loss of kidney function over time. The kidneys are essential organs responsible for filtering waste, excess fluids, and toxins from the blood. They also regulate blood pressure, balance electrolytes, and produce hormones that influence red blood cell production and bone health. In CKD, these functions become impaired. Damaged kidneys are unable to properly filter waste from the bloodstream, leading to the accumulation of harmful substances in the body. Over time, this can progress to end-stage renal disease, ESRD, a condition in which the kidneys function at less than 10% of their normal capacity. At this point, dialysis or a kidney transplant becomes necessary to sustain life. CKD often develops slowly and silently, which is why it's sometimes called a silent killer. Many people remain unaware they have the disease until it has already caused significant damage. This is particularly true for older adults, whose symptoms may be attributed to aging or other chronic conditions. Why it's deadly. Chronic kidney disease becomes deadly when it leads to the buildup of waste products and fluids in the body. This toxic overload can cause a cascade of complications, including cardiovascular disease. People with CKD are at a significantly higher risk of heart attacks, stroke, and heart failure. In fact, heart disease is the leading cause of death in individuals with CKD. Electrolyte imbalances. The kidneys help regulate levels of potassium, sodium, and calcium. When kidney function declines, these electrolytes can become dangerously imbalanced, leading to muscle weakness, irregular heart rhythms, or even cardiac arrest. Anemia. Damaged kidneys produce less erythropoietin, a hormone that stimulates red blood cell production. This often leads to anemia, causing fatigue, dizziness, and shortness of breath. Bone disease. CKD disrupts the balance of calcium and phosphorus in the blood, weakening bones and increasing the risk of fractures. Fluid retention and swelling. Poor filtration leads to fluid buildup, especially in the legs, ankles, feet, and sometimes lungs, causing difficulty breathing. End-stage renal disease, ESRD. At this stage, kidneys can no longer support life without medical intervention. Dialysis, a process to remove waste manually, or a kidney transplant is required. Without treatment, ESRD is fatal. Because CKD progresses slowly, it is often underdiagnosed and undertreated in its early stages. By the time symptoms are noticeable, significant and irreversible damage may have already occurred. Common symptoms. Symptoms of CKD often do not appear until later stages, but when they do, they may include swelling edema in the ankles, feet, or face, fatigue and weakness, nausea or vomiting, loss of appetite, changes in urination, including foamy urine, frequent urination at night, blood in the urine, decreased output, itchy skin, muscle cramps, especially in the legs, shortness of breath, confusion or difficulty concentrating. Older adults may experience nonspecific symptoms such as confusion, sleep disturbances, or a general sense of feeling unwell, which can delay diagnosis. Risk factors. Several factors increase the risk of developing CKD, particularly in people over age 60. Diabetes, the leading cause of CKD. High blood pressure, the second leading cause. Heart disease. Family history of kidney disease. Obesity. Smoking. Frequent use of certain medications, like NSAIDs, e.g., ibuprofen. Diagnosis and stages. CKD is usually diagnosed through blood tests to check creatinine and estimated glomerular filtration rate, eGFR. Urine tests to detect protein, albuminuria, a sign of kidney damage. Imaging tests such as ultrasounds or CT scans, kidney biopsy in some cases. CKD is classified into 5 stages based on eGFR. Stage 1, mild kidney damage, normal function. Stage 2, mild decline in function. Stage 3, moderate decline, symptoms may begin. Stage 4, severe decline, preparation for dialysis may start. Stage 5, ESRD, kidney failure, dialysis or transplant required. Treatment and management. There is no cure for CKD, but treatment can slow progression, manage symptoms, and prevent complications. Key management strategies include 1. Blood pressure and blood sugar control. For people with diabetes or hypertension, keeping these conditions well managed is crucial. Medications like ACE inhibitors or ARBs can help protect kidney function. 2. Diet and lifestyle changes. Low sodium diet to reduce blood pressure and swelling. Limit protein to reduce kidney workload. Limit potassium and phosphorus in advanced CKD. Hydration unless fluid intake is restricted. Avoiding NSAIDs and other harmful drugs. 3. Medications, erythropoiesis-stimulating agents for anemia, phosphate binders to manage mineral balance, diuretics to reduce fluid retention. 4. Dialysis or transplant in ESRD, hemodialysis, peritoneal dialysis, or kidney transplantation are the only life-saving options. Living with CKD. For older adults, living with CKD involves physical, emotional, and financial challenges. Fatigue, dietary restrictions, and medication management can be overwhelming. Support from caregivers, family, and healthcare teams is critical. Many older patients may opt for conservative management rather than dialysis. Living with CKD. For older adults, living with CKD involves physical, emotional, and financial challenges. Fatigue, dietary restrictions, and medication management can be overwhelming. Support from caregivers, family, and healthcare teams is critical. Many older patients may opt for conservative management rather than dialysis, focusing on symptom relief and quality of life. Palliative care teams can help provide comfort, education, and planning. Prevention. Since CKD often develops silently, prevention and early detection are vital. Regular health checkups, especially for those with diabetes or high blood pressure, routine urine and blood tests, healthy lifestyle habits, balanced diet, regular exercise, no smoking, hydration, limit alcohol and avoid overuse of medications. Conclusion. Chronic kidney disease is a progressive and life-altering condition, especially in older adults. Although it can be managed in early stages, CKD becomes deadly when left undiagnosed or untreated, leading to life-threatening complications in kidney failure. However, with awareness, lifestyle changes, medical care, and regular screenings, many people can slow the disease's progression and maintain a good quality of life. Whether managing CKD conservatively or preparing for dialysis or transplant, informed decisions and strong support systems make a critical difference in outcomes. 9. Sepsis description. A life-threatening reaction to infection causing systemic inflammation. Why it's deadly. Can lead to organ failure and death very quickly if not treated immediately. Common symptoms: fever, confusion, rapid heartbeat, and cold/clammy skin. What is sepsis? Sepsis is a potentially fatal medical condition that arises when the body has an extreme, out-of-control response to an infection. While our immune system is designed to fight infections, in the case of sepsis, the body's response becomes harmful, triggering widespread inflammation that can damage tissues, shut down organs, and ultimately lead to death. Sepsis can develop from any kind of infection, bacterial, viral, or fungal. Common sources include pneumonia, urinary tract infections, UTIs, abdominal infections, or skin infections. Although anyone can develop sepsis, it is especially dangerous for infants, the elderly, people with chronic conditions like diabetes or kidney disease, and those with weakened immune systems. How sepsis progresses. Sepsis typically unfolds in 3 stages. Sepsis, the earliest stage where the body begins to show signs of systemic inflammation in response to infection. Severe sepsis. This stage involves damage to one or more organs. For example, sepsis may impair the lungs, kidneys, or heart. Septic shock, the most critical phase, characterized by a dramatic drop in blood pressure, which can lead to multiple organ failure and death. Once sepsis sets in, it can progress very quickly, sometimes within hours. That's why early recognition and treatment are vital. Why sepsis is so dangerous? Sepsis is particularly dangerous because of how suddenly and aggressively it can escalate. It doesn't follow the slow, steady progression seen in some other illnesses. What may begin as a mild infection or seemingly minor condition can rapidly overwhelm the body. Here's why sepsis is deadly. Rapid organ failure. Sepsis impairs the flow of blood to vital organs like the brain, heart, kidneys, and liver. Without oxygen and nutrients, these organs can quickly start to fail. Circulatory collapse. In septic shock, the blood vessels lose their ability to constrict properly, causing dangerously low blood pressure that is unresponsive to standard treatment. Permanent damage. Even survivors can suffer long-term effects, including chronic pain, fatigue, memory loss, and organ damage, a condition known as post-sepsis syndrome. High mortality rate. Globally, sepsis is responsible for 1 in 5 deaths. According to the World Health Organization, it affects over 50 million people every year, killing around 11 million, many of them children and the elderly. Symptoms of sepsis. Sepsis can be hard to diagnose in its early stages because its symptoms can mimic other conditions like the flu or general infections. However, recognizing the red flags early can save lives. Common symptoms include fever, chills, or a very low body temperature, confusion, disorientation, or difficulty staying awake, rapid heart rate, tachycardia, rapid breathing, tachypnea, cold, clammy, or pale skin, decreased urine output, extreme fatigue or weakness. An easy way to remember the warning signs is the acronym TIME: temperature higher or lower than normal, infection, signs or history of infection, mental decline, confused, sleepy, or difficult to rouse, extremely ill, severe discomfort or feeling like you might die. If you or someone else shows several of these symptoms, especially in the context of a recent infection or medical procedure, it is critical to seek emergency care immediately. Diagnosis and treatment. Diagnosing sepsis involves a combination of physical exams, lab tests, and medical imaging. Doctors look for evidence of infection, elevated heart rate or breathing rate, abnormal white blood cell count, and signs of organ dysfunction. Treatment is time-sensitive and includes immediate antibiotics administered within the first hour of diagnosis to target the underlying infection, intravenous, IV, fluids to maintain blood pressure and circulation, oxygen or ventilation support to ensure that tissues and organs receive adequate oxygen, vasopressors, drugs used if blood pressure remains dangerously low despite fluid resuscitation, surgery. In some cases, surgery may be required to remove the source of infection, such as an abscess or infected tissue. Early treatment significantly improves outcomes. The golden hour after sepsis is recognized is critical for survival. Who is at risk? Anyone can get sepsis, but some groups are at higher risk: infants and young children, older adults, age 65 plus, people with chronic illnesses, for example, diabetes, cancer, lung disease, people with weakened immune systems, recent hospital patients or those who recently had surgery or invasive procedures, healthcare-associated infections. Highs are also a common source of sepsis, especially in intensive care units, ICUs. Prevention of sepsis. While sepsis can't always be prevented, many cases can be avoided through simple but effective measures. Vaccination. Stay current with vaccines, particularly those for influenza, COVID-19, and pneumonia. Hygiene. Regular hand washing and wound care reduce infection risk. Infection control. Promptly treating infections and managing chronic conditions like diabetes helps lower risk. Hospital protocols. Hospitals must follow strict infection control procedures to reduce hospital-acquired infections. For patients and caregivers, knowing the signs and acting quickly when infection symptoms worsen is one of the most effective ways to prevent sepsis-related deaths. Conclusion. Sepsis is a medical emergency that can arise from virtually any type of infection. It is unpredictable, fast-moving, and deadly if not treated immediately. However, with greater awareness, early recognition, and rapid medical care, many lives can be saved. Understanding the warning signs and acting quickly could mean the difference between recovery and tragedy. Whether you're a healthcare provider, a caregiver, or simply someone looking out for your loved ones, being informed about sepsis is one of the most powerful tools in the fight against this silent killer. 10. Parkinson's disease description, a progressive disorder affecting movement and coordination. Why it's deadly, leads to complications like falls, pneumonia, and loss of independence. Common symptoms: tremors, stiffness, balance problems, and slow movement. Understanding Parkinson's disease. Parkinson's disease, PD, is a chronic, progressive neurological disorder that affects the body's motor system. It primarily impairs movement and coordination due to a gradual loss of dopamine-producing neurons in a part of the brain called the substantia nigra. Dopamine is a chemical messenger vital for smooth, controlled muscle movements, and its deficiency leads to the characteristic motor symptoms of the disease. Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's disease, affecting over 10 million people worldwide. Though it is more commonly diagnosed in people over the age of 60, early-onset Parkinson's can affect younger adults as well. How Parkinson's disease progresses. Parkinson's is classified as a progressive disorder, which means symptoms worsen over time. The rate of progression varies widely among individuals, but the disease usually begins subtly. In the early stages, symptoms may be mild and affect only one side of the body. As the disease advances, both sides are typically affected, and the symptoms become more disabling. The progression of Parkinson's disease is often measured using the Hearn and Yahr scale, which ranges from stage 1, mild symptoms, to stage 5, severe disability, often wheelchair-bound or bedridden. Why Parkinson's disease is dangerous. Parkinson's disease itself does not usually cause death, but its complications can be life-threatening. As patients lose their ability to move, swallow, or control body functions, secondary conditions may develop. These include falls and injuries. Impaired balance and coordination can lead to frequent falls, resulting in fractures or head trauma. Aspiration pneumonia. Difficulty swallowing, dysphagia, can cause food or liquid to enter the lungs, leading to pneumonia, a common cause of death in Parkinson's patients. Blood clots and infections. Immobility increases the risk of deep vein thrombosis, DVT, bed sores, and urinary tract infections. Loss of independence. As mobility and cognitive function decline, patients may need full-time caregiving, leading to a profound loss of independence and emotional distress. In advanced stages, Parkinson's may also cause Parkinson's disease dementia, further impairing memory, thinking, and behavior. Common symptoms of Parkinson's disease. Parkinson's disease is primarily known for its motor symptoms, but it also affects many non-motor systems of the body. Symptoms may vary, but the most common include motor symptoms. Tremors often starting in the hands or fingers, especially at rest, a common early symptom. Bradykinesia, slowness of movement, making everyday tasks difficult and time-consuming. Rigidity, muscle stiffness that can cause pain and limit range of motion. Postural instability, impaired balance and coordination, increasing the risk of falling. Shuffling walk, short dragging steps with little arm swing and stoop posture. Non-motor symptoms, depression and anxiety, fatigue, sleep disorders, cognitive impairment, speech and swallowing difficulties, loss of sense of smell, anosmia, constipation, and urinary issues. Often these non-motor symptoms can appear years before the onset of motor problems and significantly impact quality of life. Diagnosis and evaluation. There is no single test to definitively diagnose Parkinson's disease. Diagnosis is primarily clinical, based on medical history, symptoms, and a neurological exam. Imaging tests like MRI or DAT scan may be used to rule out other conditions or confirm dopamine loss in the brain. Specialists often use rating scales such as the Unified Parkinson's Disease Rating Scale, UPDRS, to monitor disease progression and evaluate treatment effectiveness. Treatment and management. There is currently no cure for Parkinson's disease, but early and consistent treatment can significantly relieve symptoms and improve quality of life. Medications. Levodopa carbidopa, the most effective drug. Levodopa converts to dopamine in the brain, while carbidopa prevents it from breaking down prematurely. Dopamine agonists mimic dopamine effects in the brain. MAOB inhibitors and COMT inhibitors help prolong dopamine activity. Surgical options, deep brain stimulation, DBS, involves implanting electrodes into specific areas of the brain. DBS is used for patients whose symptoms are not well controlled by medication. Supportive therapies, physical therapy, helps maintain mobility and flexibility. Occupational therapy assists with daily activities and adapts the living environment. Speech therapy aids in addressing speech and swallowing difficulties. Nutrition and exercise. A balanced diet and regular physical activity can improve strength, mood, and overall health. Psychological support and social engagement are equally important in helping patients manage the emotional and mental burden of the disease. Living with Parkinson's disease, Parkinson's is a lifelong journey that demands resilience, support, and continuous adaptation. Many people with Parkinson's live for years, even decades after diagnosis. The key to maintaining quality of life lies in early diagnosis, effective treatment, and a comprehensive care plan that includes medical, emotional, and social support. Support groups, counseling, and educational resources can help both patients and caregivers cope with the challenges of Parkinson's. Planning for long-term care, legal issues, and financial matters is also an important step in managing the disease responsibly. Conclusion. Parkinson's disease is a complex and progressive disorder that deeply affects both motor and non-motor functions. While it is not directly fatal, the complications that arise from its progression, such as falls, infections, and cognitive decline, can be life-threatening. Fortunately, with the right treatment, lifestyle adjustments, and support systems in place, individuals with Parkinson's can lead fulfilling lives for many years after diagnosis. Ongoing research continues to uncover new treatments and potential therapies, bringing hope to millions of people affected by this challenging condition. Understanding the disease, recognizing its symptoms early, and staying proactive in management are crucial steps in the fight against Parkinson's.